So today now we're going to go ahead and do a demonstration of exactly what I talked about. The trifecta, the Setari lift. We're going to go ahead and do the quantum RF for our lovely patient Terry here under her neck. We're going to melt the fat, we're going to tighten the skin. Then we're going to do the Morpheus on her entire face for fine lines and irides. And then we're going to do the CO2 for all sorts of environmental and solar damage to her epidermal skin layer. Terry's awake. Everything's going to be done with a combination of tumescent, local anesthesia, topical blocks. And if I can do this here up on the stage, you can do this in your office in any exam room. In my office, I've got an OR, but you don't need an OR. This is how simple and easy these procedures are to perform once you know the protocols and how to follow them appropriately. I personally am OCD, which is probably exactly what you want in your cosmetic doctor, someone who's a crazy fanatic perfectionist. And I'm a fiend when it comes to sterile field. So one thing I do want to emphasize that yes, these procedures are simple and easy to perform. Yes, you can do them in any good exam room or procedure room you have in your office. But you do want to follow appropriate protocol. Make sure you're maintaining proper sterile field for your patient, for yourself. I usually give 1 gram of Keflex to the patient the day of the procedure if I'm doing quantum, not for Morpheus 8 or for CO2, but for quantum, I'll give them 1 gram the day of the procedure and that's it. And again, this is like overkill. It's I'm a fanatic when it comes to being keeping infection under control, and so it's a bit of an overkill. But in nearly 10,000 cases in my practices across the board, we haven't had one single untoward incident. We haven't had an infection. We haven't had bleeding. Nothing in nearly 10,000 cases. And there's a reason for that. And it's because we're very, very cautious. We're very, very conservative. We love these technologies. We use them within the parameters they're supposed to be used. And we're cautious with when we need to do blood tests, we do blood tests. When we need EKGs, we do our EKGs. When we need antibiotics, we use our antibiotics. So you want to practice the same level of care in your practice as well. So this is just tumescent anesthesia. It's just a ½ liter of normal saline. And then I put in my own personal mix or formula, which is 400 milligrams of lidocaine, an appropriate amount of epinephrine, bicarb, and my little secret sauce that I add to my tumescent, which is just a kiss, a little hint of dexamethasone, which I believe really helps my patients have less inflammation and a faster recovery. I'll need that right there. The first thing I'm going to do is I'm just going to put in a few little blebs of anesthesia. The very first one is going to be submental right here. Just a little bug bite. You okay, Terry? Mm-hmm. Great. And then another little bug bite here. Little bug bite here. And those are just my access points for my actual tumescent anesthesia. The needle may look a bit frightening and imposing because of its length, but it's actually very thin, very flexible. Any pain at all, Terry?
No, no pain.
Excellent. Now, the anesthesia isn't just acting as anesthesia for us. The fluid is also going to act as a bit of a heat sink, which will protect some of the surrounding tissues from any collateral thermal damage. Now, this is one way to administer the tumescent anesthesia, which is simple and easy and inexpensive, with a needle and syringe. In my office, I actually have an infiltration pump with tubing, and I just step on the pedal and the pump just goes, and it's like a garden hose just pouring out that anesthesia for me, and I'm able to anesthetize much faster with an infiltration pump. The choice is yours in terms of what you want to use in your office, whether you do it with a syringe and needle, or whether you go ahead and get yourself an infiltration pump. They're not that expensive. You can buy a good one, actually used and totally functional for probably about $2,000 or something. If you're going to be doing a lot of body work, especially like abdomen, I recommend the pump just because it'll speed up your cases. But for face and neck, syringe and needle certainly is more than efficient and adequate. How are you doing, Terry?
Good.
Excellent.
Yeah.
Now, as I said, there's a lot of versatility on these parameters and how you want to set your energy levels. The tip gets to 120 degrees centigrade. That's above boiling point. That's certainly enough to melt fat and tighten that FSN, that fibroseptal network, and give us the contraction we need. The power setting that I'm going to set here determines the diameter of that solar corona that we saw in that slideshow that I showed you, just how much that energy disperses. And because there is a circle of energy dispersal around the tip, you do not want you actually want each line to be its own line. There's really no sort of, what's the word I'm looking for?
No spread.
No, it's like you don't have one treatment right next to a previous area you treated. You have to allow space for the spread of the energy. Okay.
Where do you like your settings at?
Let me just first make sure I can get the. So look, I can get the cannula in easily through that tiny little hole that I made. Any pain at all, Terry?
I'm good.
Excellent. Okay. All right. So the decision on the power setting is going to be based on how much fat she had when I first saw her, how much loose skin she had, her age, and a couple of different factors. Let's go for 2 pp's. So that's 2 pulses per second. So with every press of the foot pedal, 2 pulses will go. And for energy, give me a 7. That should be good. Perfect. Okay, let's start with that. Overlap. You don't want any overlap of your treatment areas. So we're going to treat, as I showed in that other slide in the demonstration, this is going to be one of our lines. Then about a little half finger's breadth over, this will be the next line, and then the next line, and then the next line. And in a radial pattern, I personally don't like the energy to be activated when I'm going forward with the cannula. I like retrograde activation only because it's safer. If you're activating the energy as you're going forward, the tip could angle up and end up giving you a burn, so we don't want that. So the safest way is to go ahead and find your plane, cantilever a little bit down, and then activate all with a retrograde technique. Okay, here we go. Okay, you ready? That was already the first pass. How you doing, Terry?
Good.
Excellent. I'm going to do a second pass, same line. She has enough fat that I'm going to do 2 passes at different layers on the same line, like I showed you in the slide set. Okay, now we move on to our second line. I don't know if you guys can hear the crackles. I'll try to get closer here. Probably not. Terry, you can hear them though.
I hear them, yeah. Just little, yeah. I hear it.
It's a nice sound to hear, isn't it?
Yeah. It's like little crunching.
Yes. Snap, crackle, pop.
Yeah.
That's the fat being lysed and the fibers being contracted with the thermal energy. Let's go to 8. Yep, perfect. How you doing, Terry?
Good. I feel like it's just eating all the fat. It's crunching the fat away.
It's melting the fat away is what it's doing. Yeah, I don't know if you guys can actually hear the snap, crackle, pop, but Terry and I can hear it. And it's just a constant crackle, crackle, crackle as the fat is being treated. And I can feel beneath my fingers with what we call the seeing hand. With your eyes and this seeing hand, you're supposed to be able to form a 3D image in your mind of what's going on underneath the skin. It's like an X-ray in your mind between what you're feeling and what you're seeing. And I can actually feel this fat melting down, becoming softer, so I can tell that I'm getting the results I'm looking for with my treatment. You okay, Terry?
Yeah, and the sound is calming. It feels, like you're walking on sand or something, kind of.
Right. What I'm doing is also feeling where my tip is, because I don't want the tip activated when it's too close to my adit, to my portal of entry, because then I would get a burn. There we go. That's pretty much it. That's it. That's it. Her neck is treated.
Wow.
Yeah. Fast, quick, and easy. And I don't know if the camera can pick it up, but this is actually melted oil that I'm able to extrude. Can you see that? Little oil droplets on top of that fluid. That's how much fat we've melted. So she will see, if not tomorrow, certainly within this first week, a very nice improvement with reduction and tightening of this skin underneath her neck. Now, on this procedure, I just finished performing, and as you recall, I said that the Morpheus 8 and the CO2 are delegable to your RN. So now our lovely RN, Brittany, will come on stage, and she's gonna go ahead and do Terry's Morpheus treatment and CO2 treatment while I go see my next consultation. You are done.
Thank you.
We're going to go ahead and just, I'm going to have you step off to the side, and
Okay.
Jordan's just going to put a head garment on you
Okay,
for the
you got
quantum.
it.
That's it.
Thank you.